minutes from the site visit.
Ooh. Good effort. Yay, welcome. And you ladies, whereabouts are you from?
Master.
Okay.
Yeah, Brisbane. Yeah.
Oh, well, it's usually the locals, the people who live the closest who are running the latest. It's like the people who live the closest to where they work, they're always late.
Yeah.
So we're actually live. If you just
You're
want to say
live
hi
already?
to the guys on there, it would be great. I'll just be good if we could get some sound check,
Yeah, sure.
because we've got Hayley, Zara, Amanda, Dorothy, Tony, and Sandra all waiting there. So
Okay, all right. So
yeah,
we actually do run this event as a live webinar specifically for people who are often in remote locations and can't have the opportunity to easily get to us as you guys have made the effort to get to us tonight. So I actually really appreciate that you've driven here tonight. So thank you all so much. And I'd just like to welcome those of you who are online tonight. We're going to start fairly soon, but welcome. Now's probably the time to go and grab yourselves a cup of tea, a glass of water, and get comfortable and ready to enjoy our webinar tonight. Thank you so much. Please don't be concerned about the fact that there is a camera behind you. It won't actually see you. It'll just see us. And that's just for people who are at home tonight watching what's going on. So just so that you all know as well. Yeah.
it'd be great if they could let us know if they got any sound there
Yes,
at
can
home.
I just get a show of hands as far as sound's concerned? If you can just let us know, is there? Are they able to put their hands up?
Oh, they can just write into the chat. That'd be great.
Yeah. So
Yeah.
we've got actually live chat working tonight, and Kelly on our front desk will most likely be answering all of your questions. She's getting ready right now. So please make sure you do use the live chat. It is there for you to ask questions. And we'll make sure that also any questions from our in-rooms audience tonight, if they ask questions, which we hope they will, we'll repeat so that you can hear them. But please just let us know now, is the sound okay? And I'll be back with you shortly. Thank you so much.
That's great. Sharon and Hayley, thanks.
Latecomers a few minutes to join us.
Yeah.
Oh.
That's all right.
Where's the vote? I think we should wait just a few minutes for people to get here. We're about to go phones over, I was going to say. notepad. Did you get a little notepad? Maybe checking your bags. I think I will make a start with that later join us because there's quite a few people online as well with us now. So welcome. Thank you so much for coming tonight. My name's Felicity. I'm the CEO of Weight Loss Solutions Australia. And one of the things I like to do before we get started is just to actually ask you with that little notepad, just to think about if you could be sitting here 12 months from now, lovely, that's for you, visualise for you the top 3 things that you would most like to see that would change in your life as a result of weight loss surgery. So try and look 12 months from now, what does that look like? And it's different for everybody. And I've asked everyone at home online as well to do the same thing. Grab a piece of paper and a pen. This is just an exercise for you. For some people it might be sitting in an economy class aircraft seat and to be able to actually not have to use an extension seatbelt. For some people, it's tying their own shoelaces. It could be having the energy to actually make it up a flight of stairs without huffing and puffing. It could be something to do with reducing medications that you're on now. But those goals and that vision of where you want to be 12 months from now, it's different for everybody. So just take a little moment to reflect and write that down and hang on to it, because there is nothing better than seeing people look back on that and seeing how far they've come in 12 months and watching all of those changes take place over such a short period of time. And to be honest, 12 months is a short period of time, especially when you've been someone who's struggled with your weight for years and potentially yo-yo dieted and tried everything on the planet to assist you to actually get to achieve a weight loss outcome that you found unattainable for whatever reason. In fact, it's actually really funny. A lot of our patients are the best dieters on the planet. You've probably tried, who here has tried a shake diet or tried multiple diets, exercise programs, the gym, Jenny Craig, Weight Watchers, the Pineapple Diet, the Israeli Army Diet, you name it. I mean, I think I've heard everything over the years. Does that relate to you? Yeah. And it's fascinating how, statistically 95% of diet and exercise programs alone fail. And the one thing that you're here for tonight is to set yourselves up for a future of success. And that is an absolute given and something that we know is achievable, manageable, sustainable, and realistic. Or can I just ask the phones off if you've got phones on? Thank you so much. This is the one thing that we want to actually try and achieve for you in an environment where weight loss surgery is part of the equation, is to set you up for a future of absolute success and never having to look back on the roller coaster of dieting ever again. So if you are someone who's actually been through that yo-yo dieting phase in your life and you're absolutely sick of it, then this is actually going to be the life-changing moment in your life. And, there's a light bulb moment for everybody. It's different for everybody. Who can you share for us? What is that light bulb moment for you? Is there one event in your life or one something?
Just photos, really.
Yep.
Yeah, that's what sort of driven me to do this.
Okay, fantastic. Anybody else got a specific one thing that's actually made them think this is my time, I've got to do this now?
I've got some health issues.
Health issues. Yep.
Better.
For many people, type 2 diabetes is probably one of the most dominant that we would see, but hand in hand with that is the sleep apnea, the joint-related problems, the low energy, the risk of cardiovascular disease, and the list is, goes on and on and on. And, that's our ultimate goal is, number one, is to hopefully resolve, if we can, control and manage better any of the medical comorbidities that go hand in hand with excess weight. But also prevention is critical, because we know that over time and as you get older, those complications that go hand in hand with excess weight are likely to become more pronounced. Whether it's the risk of type 2 diabetes or cardiovascular disease, we want to make sure that that's not going to be your future. So that's probably one of the reasons why we're all here tonight, and what we're wanting to look for is the absolute solution that's going to give you a permanent solution to the weight loss issues that you've had forever. Just a welcome to all of our people online tonight. Hi, Nick.
Hello.
Welcome to everyone online. Please don't forget to ask questions. Kelly will be happy to answer them. All right, a little bit about me. My name's Felicity. I'm the CEO here of Weight Loss Solutions Australia. This has been my absolute passion for well over 16 years now, and I never stop to feel absolutely overwhelmed at the positive outcomes that we get to share with patients every day. The reward for me is that in itself is actually being on that journey and sharing with patients the wonderful things that they achieve in their lives, from the health outcome point of view and from quality of life outcomes. It's nothing short of actually exceptionally overwhelming and fantastic. And the statistics in Australia are pretty overwhelming. I think it's something like 1 in 4 adult Australians is suffering from being either overweight or morbidly obese. So every single one of us has someone whom we know who is either part of our close family or friend network who's been in touch with or has a problem with being overweight or morbidly obese. For me personally, I wish I could have offered this surgical procedure to my mum many years ago. Never had that opportunity. Both my parents are now in their 80s. They've both had quadruple bypass. My dad's got a pacemaker. My mum's never been a terribly active or mobile person, but I watched her go through the whole dieting roller coaster for years as a teenager. My one big thing is if I could have offered this to her, it would have been the greatest pleasure in my life to have seen that being an opportunity for my own mum. But sharing it with patients here is, just fantastic, and we all absolutely love it, and we do it with absolute passion every single day. Tonight, you're actually going to hear from our professional team, and one of the biggest themes that you're going to hear throughout the presentations tonight is the connection to our team is the critical factor that will give patients who come through our system the best long-term outcomes, connecting with a team of people who are here to support you throughout the whole journey. So tonight you're going to hear from Natalie, who is our registered nurse, bariatric nurse. She's actually going to share with you a bit of information about all the procedures and how they work. Her role, she's pretty much the #1 person who you see here in the clinic. And she's part of the link to your whole journey throughout the process. And you meet with her at various points in time. So she's very involved in the whole program and with all the procedures. Brianna is our accredited practicing dietitian who has just recently joined our team with some fantastic experience to bring to all of our patients, and has a lot of experience in the area of diabetes management, which is such a big thing in our patient population. So she's going to talk to you a lot about how food relates to each of the procedures, but also to give you a feel of what to expect from working with a dietitian team member. What does that look like? Our system here is a 12-month limited access program. And that means that you get to work with our team as frequently as you choose over 12 months. And you're also going to meet with one of our psychologists. We have 2 psychologists on the team, Leslie and Warren. Tonight the psychologist is Warren. He's also Mr. Mum, so I'm assuming he's still waiting for organising his kids and his wife at home before he makes a quick dash here to come in and share with you what his role is all about. Last but not least, we will have the pleasure of introducing you to the most awesome couple of people who are the most delightful patients who are going to share with you their story. I'm not going to say too much about them now. They're a husband and wife team, which is just the coolest thing ever. Lots of fun when you've got a husband and wife team to work with. Nick and Karen have just been the most delightful couple to work with since day one. We just adore them. But we were actually hoping to have them here. I think it was around about May when Karen had hit her 12-month point in the journey, but they were unable to come for all sorts of things. So tonight's a really special night to have them here to share with you. So I can't wait to introduce you to them later on. Any questions before we keep going? Next big thing, ask questions. This is all about you. We're here for you. We want you to leave well equipped. We want you to walk out that door feeling as though you've had all of your questions answered and that we've helped you feel as confident as possible about making that next step in your journey. Okay, so please interrupt us, fire away if that's what we're here for. And once again, welcome. Thank you for joining us. I'm going to hand over to Natalie to tell you all about the procedures. Please make Natalie welcome.
Good evening, everyone. I wasn't quite ready for that. I thought Felicity was going to talk a little bit more. I'm sitting there in my own little world. Welcome. Like Felicity said, my name is Natalie. I'm the nurse here at Weight Loss Solutions. More often than not, I'm the first point of call. I'm the first person that you meet within the start of your journey and the commencement of your journey. And I get really involved in the patient's journeys along the way. We talk about basically how you're going, what sort of history you've got weight loss-wise, what medical history you have. And, we actually go through all the procedures. If you have any questions, if there's one particular procedure that you're interested in, but you'd like to know more about another, then I definitely go through that with you, and you can actually choose what you like from there. And I give you the best education as possible so that you can make the best choice possible and give you a guide as to what I think probably suits you with your lifestyle. Felicity did mention obviously a lot of comorbidities that can come with people being overweight or morbidly obese. And a lot of those comorbidities we actually do see here a lot at Weight Loss Solutions. Things like, for example, obstructive sleep apnea. Has anyone heard of sleep apnea before? Absolutely. Okay. Those the CPAP machines that people sometimes have to use, the ones that go over your face. Things like heart disease. Okay. Has anyone heard of, or all those sorts of associated things to do with heart disease, strokes? Diabetes is a really big one, obviously. That's a particular comorbidity that a lot of patients that come through our doors do actually have. And we're very blessed to have Brianna with us, who's actually got that really big background in diabetic education as well as diabetes. So, which is really, really great for us. So I suppose these are the things that we can actually help you with. These are the things that we can go through on your weight loss journey and try to. I've got patients of mine who have actually who were insulin dependent diabetics, who 3 or 4 weeks after surgery have cut their insulin in half, if not down to 3/4. So, and that's close contact with their GP as well as close contact with us and the dietitian. Okay, so that's a really important thing, all right? One of the things that what I'll do is I'll go through in a minute with you in regards to the particular surgical procedures that we have. Just to show of hands, who's interested in the balloon? No? Anyone interested in the balloon?
Can we just wait to see if anyone online is interested in the balloon?
Anyone online interested in the balloon? That's all right.
Mostly interested in the
Mostly
sleeve.
sleeve. Anyone hear about the sleeve? Interested in the sleeve? Great. Okay. All right. So what I'll do is usually I just focus a little bit more on the particular procedure that most people are interested in. So I will touch over the balloon, very, very briefly touch on the band, because the band is a tool that it has been pretty much superseded by the gastric sleeve now. And then I'll go from there. One of the first things I want you all to understand is that any of the procedures that we offer here are tools. And you will hear us say this often, and you'll hear us say it all the time, because we want you to understand that this is only a tool, okay? It is not the be-all and end-all. It is not a magic cure. It is not something that you can go, great, I'll have this done and I can just eat what I want for the rest of my life because it'll make me eat small. It doesn't work like that, okay? You will never be on a diet again, which is great. Okay, that's the really great part. But the important part about this is that what we want you to do, and the gorgeous dietitian will go through this with you, is we talk about nutrient-dense foods. And this is the really important part, because every mouthful counts. How much room do you think you have with these particular procedures? If you think about it, and we're taking out 80% of your stomach with the sleeve, for example, you don't have a lot of room. So you can see already that every time you go to eat something, it has to be nutritionally dense. You have to be getting and our common phrase here is more bang for your buck. All right, so that's the really big thing that we want you to understand. That's why we do the full 12-month program. That's why we have as much education and as much hands-on with us as possible. Because it is a big learning curve. It is something new. It may come from some of the dieting that people have done before. A lot of people know a lot about food. And that's where Brianna comes in and consolidates that information that you've already been given over the years and puts it together for you so that you can really do the best you can after you've had your procedure, okay? And that's why we love to see you after surgery. We love to see you, particularly for the sleeve, we love to see you at 2 weeks. We have a workshop that we do at 6 weeks, which is really great, and that talks about food and how to build a meal. And then we love to see you at 3, 6, 9, and 12 months. But that's just the minimum. That's not saying you might want to talk to Leslie or Warren once a fortnight. We've got some gorgeous people who do. Once a month they have appointments with the psychologist. You might want to talk to Brianna once a week. That's what she's there for. You might only want to see me once a month, but that's okay. That's what I'm here for. All right? And that's the beauty of our program. And we want to give you the best education and support possible so that we know you're using your tool in 5, 10, 15, 20 years. Okay, so that's what we're all about, and that's why we do the full 12-month program. So what I'll touch on, I'll just briefly touch on the balloon first, if that's okay with everyone, just to give everyone an idea of the tools that we do here, and also being that we do have some people online, just to give them the experience as well, so that they understand what we do here. So has anyone heard of the balloon? Yeah? No? Yep? No? Okay, so it's a bit of a mixed bag. Some people have. I do play show and tell. I like show and tell. All right, so this is what we call the gastric balloon. Okay. Basically, what it is all about is a balloon, as you can see, and before you laugh, yes, I understand it looks like a breast implant, forgive me. All right. It does not have as much air as this. This is a sample that I got given that I filled up myself, and I just got to the end of it, went, oh, that'll do. People will understand, and I'll show them. So, I put that air in there. So it won't jiggle and wiggle, which is good. But basically what it is a balloon like this, and people feel free to have a look and feel and squeeze. And what we do is we actually put that balloon in under a light sedation. Has anyone heard of a gastroscopy or a colonoscopy before? Yes, folks? So we don't do a colonoscopy, that's okay. We just do the gastroscopy part, which is down the throat. So we go down the throat and we have a look at the anatomy of the stomach. And then we insert this balloon and we fill it up with normal saline, and we actually put a blue dye in it as well. Okay. Now the whole idea of the gastric balloon is to actually sit up in the top portion of the stomach, as you can see here, all right? And basically it's a forced portion control. So you are looking at eating small meals frequently. And what we're doing is we're teaching your stomach how to push food around that balloon, okay? We're teaching your body that it's okay for you to have smaller meals, okay? So all the enzymes in your stomach and the nerve endings around the stomach get used to really small portions over the first 6 months. Okay. After that 6 months, and with that also comes a bit more of an in-depth process with us here. We actually want you to see us once a month, and that's really important, okay? Because this program really is about learning how to reset your small meals and really frequently. And then after that 6 months, what we then do is we actually go in and we take the balloon out. And then for that second 6 months, we're consolidating all the information, all the education that you've gotten in that first 6 months. And we're continuing with those monthly appointments. And that's the really important part. And like Felicity said, follow up, follow up, follow up. It's what we're all about. So during that second 6 months, you're just consolidating all of that information and education that you've learned in that first 6 months to maintain and continue on. So with the balloon, it's really, really great. One of the things that we do, like I said, is put a blue dye in the balloon. Does anyone think why we might put a blue dye in the balloon? Yeah, in case it leaks, that was the response. So that's exactly right. And what will happen is you'll actually pee green, which is really good. Yeah, so then we know that something's gone a bit amiss and we can fix that situation. Okay, so that's really exciting for us because then we know that there's a fail safe. Yeah. So the great part about the balloon program is that it's actually great for people who might have a little bit of weight to lose, say before knee surgery or hip surgery. Your orthopedic surgeon might say, look, we need to get your knee done, but you need 15, 20 kilos off this. Okay, that's a great, great solution for that moment. Great for people who just want to lose or just need a little kick up the bum. They're on their way, but they just need that extra help. And this is the great part about the balloon. Okay. Usually we go for, we offer it to patients who have a BMI of say 27 to around 35 or 36. But again, everything is very case dependent. And that's where you come in and you chat to me about it and we choose the best tool for you. Yeah. Does anyone have any, that was a really brief overview of the balloon. Does anyone have any questions about that? Okay. Any questions online? Feel free to type them in and I'll answer them for you. So, any questions?
Well, there is, but you can save it for when you're talking about the sleeve, because there's a bit of a question in relation to sleeve and bypass. But
okay, lovely. All right, no problems. When we get to the sleeve, we can definitely answer that for you. The second one I'll really touch on really briefly is called the lap band. Who's heard of the lap band? Yeah, so it's been around for a long time. A long time ago, it was actually only the only bariatric surgery option that people had. So, for a long time there, it was the one size fits all. Now, obviously, that's not it anymore. We do have a number of different types of tools that we can actually use, which is absolutely fantastic. But in essence, what the band comes down to is that what we do, once again, show and tell. I love my show and tell. We have a stomach, okay? So basically, as you can see from the picture up on the far corner there, what we do is we put a band around the top of the stomach and we form a pouch. And that's basically what we do is every time we're eating, this food will come into here and that becomes our holding area for our food. So as soon as that's filled up, then you're full. Okay? Now how we obtain that is actually using this piece of equipment here. So this is the part that sits around the top of the stomach. And you have what we call a port that sits just underneath the skin, just down here. Now what we do is we actually, can everyone see the diameter of that? See how that's quite large at the moment? And can everyone see the sort of bubbly bit in the middle, the plastic in the middle? What we do is we actually insert some fluid into this port here, which travels through this line and blows up this area here. So the diameter of it's smaller and smaller until we get what we call the green zone, which basically means we've got patients who are eating small portions frequently, feeling fuller for longer, and they're either maintaining their weight or they're losing it at a really nice slow level. Okay? So the band is done laparoscopically. It's done via keyhole surgery. Has anyone heard of keyhole surgery before? Yeah, we do lots of procedures with it now, which is really good. It's only a one-night stay in hospital, okay? But with this particular band, there is a lot of maintenance, but that's where you and I become best mates. Okay? So in the initial stages, you'll actually come in and see me quite frequently because we need to adjust this to a suitable level for you. And that's the great thing about the band is that even though the sleeve seems to have overcome it with popularity, there still is a small place for the band because there are people out there who really do want to be able to have full control over their bariatric tool. And this is the opportunity for that, which is great. So, you know, you do have the opportunity to be in full control, and that's where myself and the patient go through that. Every time they come in, we have a chat about what's happening, how much they're eating, what's happening in their life, those sorts of things, and then we adjust our tools as necessary. Yeah. Does anyone have any questions about that? I didn't go into too much detail. I'll show people anyway, just so you can have a look. Has anyone got any questions about that one? If there's any questions online, feel free to type them in and I'll answer them as I go along as well.
What are the complications?
With the band? Long term. So look, there are a couple of things with the long term with the band rather than immediate term. One of the things that can happen with the band is a little bit of a slip. So basically what happens is when the band gets inserted, you do have a little suture that comes around on either side of the band so that it doesn't slip. But over time, what you can have is a little bit of more extra stomach comes up through and sits out over the top. Okay? So it forms a bigger pouch. Does that going to fall down on me? No. It's done it before. And it nearly whacked me on the head. And so it can form a little pouch. And there's a couple of things that we do. Patients, my band patients, they describe it as over a period of time, their band has gotten a little bit tighter. And then it gets so tight that it's quite uncomfortable, they might get a lot of reflux. And that's when they'll come into me. What we do is we actually empty the band altogether. Yeah, we empty it altogether.
That's
Yeah.
what I'm asking.
Yes.
I've got made.
Yeah.
I can't keep
Yeah.
anything
understand.
out, and
Yeah.
even fluids I'm struggling with. So.
Yeah, you need to see me or like tomorrow, now. Yes, there is no waiting. If you can't get in fluids, you don't.
Great.
Thank you so
So,
much.
Let me just say that I was 135 kilos, okay? So it does work fantastic. And come hell or high water, I've argued with my doctors I am not having a damn thing out, okay? Because it does work.
Yeah, it is a tool.
However, I am struggling at the moment.
Yeah, and you need to use it, and this is what it comes to. This is why it's actually a tool, and this is why you've got to have a really close relationship with someone in the area that can actually help you.
And my doctor went on
Yeah.
sabbatical 2 years ago and hasn't been back. So that's why I'm here, ladies, okay?
Excellent,
So-
excellent. So look, and that's a really important part, and for our online audience, that's a really important part, and this is why it's so good here at Weight Loss Solutions that we do have that full team. And these are the things where we say, okay, you know what, you need to come in and see us, you know, as soon as we can or as soon as you can. And they're the moments where you can give us a call or flick us an email or ring and make an appointment. Okay, so slippage is one thing that can happen. Long term with bands, there is one other thing that can happen. It's called erosion, and it's quite rare. Like anything in life, you know, it's quite rare. Where the band actually starts to push into the stomach a bit too much. Okay, so that's when it would have to be removed. But the slippage we can actually fix by removing all the fluid, letting your stomach settle, and then trying again. Because people who have the band have got a tool there, we want to use it. You know, there's that word again, tool. We want to use it. okay? And that's really important to us. Yeah, so we'll have a chat later.
Yep, cool.
Done. All right, the sleeve, which is what everyone's interested in, okay? So basically the sleeve comes down to, we're taking out 80% of your stomach, okay? We're sealing this off with titanium staples, and up the top we actually reinforce it with glue and Teflon. Can you see up the back end? Here it comes down the front, so you can see. Yeah, you're right. Okay. We reinforce the top with glue and Teflon. All right. Now the reason that we reinforce it and seal it off so well is one of the complications. Has anyone done any research? Anyone know what I'm talking about? What am I talking about? A leak. Yeah, absolutely. So a leak for those audience members. Leaks are, let me be honest, they are nasty. You'll get very, very sick for a very long time. You do not want one. Hence why we have such a good A, surgeon, and B, why we have such a good team. Because with our support, we're going to keep any minimal risk you already have at the absolute minimum, okay? So what we do is and what can happen is if we don't follow our post-operative diet, which the gorgeous Brianna will go through with you in a minute, we don't follow that and aren't listening to us, then your risk increases, and that's not what we want, okay? So that's really important to us, and that's why we have that support, okay? It's done laparoscopically. Again, a lot of us have heard of laparoscopic surgery, okay? It's a 2-night stay at the Wesley in Brisbane, all right? Who was from up that way? Somebody with, yep, lovely, yeah, pretty much, okay, so that's great. So it's not far from most people, which is good, it's pretty central. What we then do is that, I'll tell you about the 3 major pain complaints that we get about this particular procedure. The first one is related to the fact that it's laparoscopic. Has anyone had laparoscopic surgery where they get shoulder pain?
Shoulder and
chest pain.
And the best way to get rid of it is to get up out of bed and walk around.
Yeah, absolutely. So who knows what that might be from? Yeah, it's gas. So when we do laparoscopic surgery, we actually blow up the belly so we can see what we're doing, and we use carbon dioxide to blow it up. And so the body then has to actually get rid of that carbon dioxide, and it does get in and out of the body, but sometimes it can get caught in funny places. So the ways to get rid of it are moving. That's the first thing we'll say. Hop up and start walking. Okay, small walks to get rid of it, but that's the first thing we'll say. Sips of peppermint tea are the second thing. And the third thing is heat leaks or hot water balls. Okay, so some of our patients get it, some people don't. It is so dependent on who you are and what happens. Second major pain complaint. Well, you've had major renovations, you are going to get a little bit of pain, okay? But we actually send you home on pain relief. And in all honesty, by day 2 or day 3, most people have reported back to me that they're on Panadol. So that's pretty good pain loss, okay? And a lot of people come to me, they have bad knees, they have bad hips, they have a bad back. We've got lots of people who've had previous back surgery, and I say to them, well, look, not only will obviously weight loss help that so much, and help reduce the weight on all of those joints and things, but also, if you've got back issues or severe knee issues or things like that, this pain is going to be nowhere near that, which is really good. Okay. The third major pain complaint I get in regards to this particular piece of surgery is because this is a long, thin tube now, okay, we don't want it to flip or move. So what we do is we actually anchor it back into the mesentery, which is a fatty layer that covers all of our internal organs. We've all got it. And the doctor actually uses an anchoring stitch, okay, to keep that in place. Now that stitch is dissolvable, like pretty much everything else. However, you might find you have a little bit of stitch pain, so you'll feel like you've got a finger pin sitting underneath the left-hand side of your ribs there, okay? It might be a little bit niggly, a little bit annoying, all right? Again, heat weak packs, paracetamol-based drugs, that's fine, okay? Some people get it, some people don't. And this is the big thing about the surgery. There are so many things that some people actually end up with and some people don't. You know, I have a lot of people that come into me at week 2 and say, I don't even feel like I've had an operation. I feel really good. I know I'm on my post-op diet, but apart from that, I feel brilliant. And I have other people that come into me and say, I'm just so tired. I'm just so tired. I just want to go to sleep now because I'm just so tired. So, and that's why we say to everyone, everybody's different, okay? And everybody's journey is different, but these are the things that you can expect. So with this particular procedure as well, we do send you home on anti-nausea tablets just in case you need them. And we also send you home on anti-reflux tablets. Because reflux is a really common side effect of this particular procedure as well as our other tools. Because if you think about it, it's a very long thin tube now. The stomach acid doesn't have anywhere to go. It doesn't have the whole stomach to churn in now. It's only got one way to go and that's up. So we give you some medication to help you with that if you're suffering from that, which is really good, okay? And that helps prevent any extra reflux or anything like that that might happen. Okay? We do say watch out post-operatively for complications, for example, constipation and diarrhea. So diarrhea, we, funnily enough, don't worry about too much unless it's interfering with your life. But the constipation we don't like, okay? So then we'll tell you things as simple as how much fluid are you drinking? Are you getting in enough fluid in that first little bit? Are you sipping your fluid continuously? And that's, once again, where it comes back to having a great team and that education and support, and that's so important, okay? Things like if you need to have some prunes, pears, you know, all the usual things that you know in your head that you just forget about because, you know, you're in that moment, okay? With work, for example, okay, so what we usually say with work is one week minimum off, 2 weeks would be great. Now, that also depends, again, on what you do, where you do it, what you do, okay? So that's where you have a chat to me and we say, okay, look, I work from home. I have an office job. I can work only 2 or 3 hours if I need to. If I started that on, you know, day 7, day 8, would that be all right? Of course it would. You know, and that just depends on how you and you're feeling and how you're going. Okay, so again, it really is how you're going. One of the big things with laparoscopic surgery is that we are assaulting your abdominal wall muscles. So does anyone know what the other big no-no might be after surgery, after any laparoscopic surgery? No lifting. Yeah. Okay, so that's a big one. That goes with any sort of surgery where we cut any sort of abdominal wall or anything like that. Okay, so we say no driving for the first week. No vacuuming, mopping, sweeping for the first 2 weeks. And yes, I'll write you a note. I say that every week. Yes, I'm happy to write you a note. With big bold writing across the top, doctor says. And then from there, it's also no heavy lifting for about the first 4 weeks. Okay. So I have lots of patients who are young mums, and I say, all right, think about it now. If you can't lift little one, medium-sized one, big one, what can you do? Okay. If you can't lift up your fur baby, you've got a gorgeous fur baby that always sits on your lap or you pick up and take everywhere. What can you do? Get a little doggy handbag. Excellent. Those sorts of things, all right? So they're the things that we get you to think about when you come in for your first appointment and prepare you for. Okay. Now, there's always things that I forget about the sleeve. So what I might do is I might ask questions if anyone has any questions, and that'll probably remind me of the things that I've forgotten. So I've got an online question.
Can you answer a question for Hayley? She's asking, what is the difference between a sleeve and a bypass?
Okay. So Hayley, the big difference between the sleeve and the bypass is with the bypass, you're actually using some of your intestine. Okay. So instead of just taking away some of the stomach, what you're actually doing is you're taking away some of the stomach. Plus, if you think about the intestine comes down here after this, we're actually getting a piece from down here, bringing it back up to the stomach and sewing it back in. Okay, so you can already see that you've got a couple of more areas that you've sewn. All right, so you know the risk of complications for that is just that little bit higher. And in essence, what you're doing is you're bypassing this section of the intestine. Okay, with this section of the intestine, that's called the duodenum. That, in all honesty, it actually absorbs most of the glucose and most of the sugar that is actually produced or eat when you eat, and it's actually digested down there. So you're bypassing that area. So a lot of the time with the bypass, what doctors do with that is they use it for patients who might have really, really unstable diabetes. Someone who has a lot of comorbidities where a sleeve just might not be appropriate at that stage. So that's the big difference between that. There are a few more issues with the bypass, things like you've got to be very aware, you've got to have close contact with your dietitian just so that we can prevent things like malabsorption, all right? And, those sorts of things are really important. So that's when having a close team is very, very important. Yeah. Do we have one more question? Yeah.
Yeah. So this is a question from, I think it was Tony, who suffers already from reflux.
Yes.
Wanting to know, will the reflux get worse if she has a sleeve? And what's the long term, if she's on, say, for example, Somac or Nexium, is she likely to still need to take her medication?
Okay.
So probably you're the best person to answer that.
Okay. So reflux can be caused from a couple of different things, and this is where the cause of the reflux is a big, question as to what will happen post-operatively. Has anyone heard of a hiatus hernia? Mm-hmm. Yeah. Does anyone know what it is? So Tony, if you don't know, a hiatus hernia is actually where you have your stomach and you have your diaphragm, which is the big muscle that sits in between your chest cavity and your abdominal cavity, and it sits all along here, and it has a small opening through your esophagus, and that's it. With a hiatus hernia, what happens is up this section of the diaphragm, you actually end up with a small little hole or a little weakening. So the top of the stomach actually pokes through, okay? So that if you can imagine already that would cause a lot of reflux symptoms. You would get a lot of heartburn, you would get a lot of regurgitation and those sorts of things. So if something like that is noticed, if you undergo a sleeve and something like that is noticed, the doctor actually fixes that while they're there because they can't do the procedure without having the stop of that stomach. They need to cut that away. So that's actually fixed. So if you have a hiatus hernia prior to surgery, and that is the reason why you're getting reflux, even without you knowing it, I've had a lot of patients who've had that fixed post-surgery and their reflux is actually decreased. Now, if your reflux is from overproduction of stomach acid and you're already on Nexium and it's not really associated with hiatus hernia, which people don't really know whether or not it is until they've actually had surgery because not everyone knows they might have one. Look, what we do is I have had a lot of patients who have had severe reflux preoperatively. You've also got to think about your anatomy. Now, if you're overweight, you've got a lot of weight pushing on your stomach, don't you? Pushing on your stomach and you get a lot of acid, there's only one way it's going to go, and that's up. So as you're reducing the amount of weight you have, you're also reducing the amount of pressure you have on your stomach to reduce those symptoms of reflux. So they're the things hopefully that will happen, all right? But we also do put you on Nexium post-operatively, and I have had a few patients who have had reflux right up until 6 months. I will be honest, I don't, as people here know, I don't, I tell it like it is so that everyone is fully informed. So one of the things that you would do is have close contact with us. This is where the team comes in handy. So we would actually talk to you about your reflux frequently, see how it's going. If it was getting worse, then we would treat that and we would talk about it and see what we can do about it. Now, a lot of my patients, a lot of their reflux and things like that do go away by around that 6 month mark, if not sooner. But it also depends on how you're going and what's happening. Yeah. How's that? Tony, hope that answers your question. Does anyone in the audience have any questions about the sleeve?
What sort of weight loss could you expect on a sleeve, like with the different procedures? Do you have like a limit or?
Sure. So the question was for the online audience, is there a limit or is there an expected amount of weight loss for the different procedures? In all honesty, the balloon is probably the only one. There is a, not an expectation, but an idea that we might have of how much weight you would lose in the first little while. And that's say between 10, 15 kilos, maybe up to 20 kilos in that first 6 to 12 months. But that's not saying that you couldn't continue the great habits that you've already formed while you're with us and continue those on into the future with your great slow and steady weight loss. With things like the sleeve and the band is very variable, again, depending on how you're going as a person and how control we have, how much control we have with your band and what's happening, and your portion sizes and things like that. So obviously over time, we put more fluid in, we reduce your portion sizes, that's how it works, and therefore we're going to reduce weight that way. And with the sleeve, there is no set amount. There is no way that I can say to you, yes, in the first week you'll lose 10 kilos, because that's not going to happen, and in fact that's dangerous, so we don't want you to lose that amount. But in saying that, patients who undergo the sleeve procedure lose their weight a lot faster than other patients who have the balloon. So there's no set amount. There's no real limit. It is actually limited by your body. So your body will tell you when it wants to stop. It's very, very hard to go underweight. You need to try really hard. So that's the great thing about your body as well, is it will actually try to stay at a normal level for it. Yeah. Okay. Any other
Food restrictions?
Yeah, sure. On both band and sleeve. Okay. So I've had a lot of band patients report back to me that there are a few things that might not go down as well as what they would like. And they're things like, say, breads and heavy meats. They report back to me that, look, sometimes they just get a little bit stuck or they get a little bit caught. And so I either need to chew. Now, chewing well is vital with any of our tools, as you can imagine, all right? But chewing well comes into absolute effect when it comes to those sorts of things. So they're the only reports that I get back about the band. The sleeve, no. The sleeve, I haven't had anyone say to me, 12 months, I can't, yada, yada, yada. There are some things in the beginning stages that your body may not like as much as others, and that's what the gorgeous Brianna goes through with you, okay? And the reasons for that, and we'll talk about this, is that the enzymes in your stomach get stripped a little bit during surgery. So if you think about it, if you're going to go and eat, say, something that is really high in protein or really high in fat, your body needs those enzymes to break that down. Now, if we've stripped out those enzymes, it's going to take a while for that to come back. So they might seem a bit heavier in your stomach. So for the first little while, I do have a lot of patients of mine say for the first, 2 months that meat doesn't go down too well, plain meat. They can eat mince, but if they try a steak, in the first 6 weeks, you're not eating steak anyway, but in that last 2 weeks out of the 8 weeks, if you're going to go with steak, they find it sits a little bit heavier. But there's no restrictions as such. You need to listen to your body. Yeah. Any other questions? Look, I'm here at the end. I've nabbed enough. The gorgeous Felicity hasn't stood up and waved at me yet, which means I probably am going okay for time. But if there's any questions, feel free to talk to me at the end. Thank you very much.
You've got a lot to say, a lot to share. You talked really fast, so I hope you've taken all of
Sorry.
that in. There's been some really interesting questions online. One that I'll actually just ask you in 1 second, and that's about the follow-up and aftercare if you are a remote patient. If you are living a long way from us, Skype, phone, there's all sorts of other technologies available that we occasionally also employ, but the most popular are Skype and phone. We love Skype because it means that you can actually see the person that you're talking to, and you know that if you're online to the psychologist, you don't want him to actually be busy on Facebook at the same time. You want him to be dedicated to talking to you. So that's one of the reasons why I do love Skype for patients who are remote. But phone is also very popular in our practice. You'll find that Brianna is typically on the phone to patients weekly for quite some time. So the opportunity's there, the access is there, and there's no excuses for having lack of contact and lack of follow-up, no matter where you are in the country. And yeah, that is something that I will impress upon everybody, that we do really stress that. And for all of you as well, you don't always have to be physically in the clinic. If you can't get here, that is available. You guys have travelled already quite a distance to be here tonight. Coming for your initial consultations, I think, is really valuable. Having that one-on-one time with the team is really important. We repeat those for our distance patients. They do them via Skype and phone, but then when you come down for surgery from wherever you come from, whether it's Townsville, Mackay, Gundawindi, it doesn't matter where it's from, where you're coming from, you then repeat those face-to-face appointments. So, can really replace face-to-face, but it's so important to have the technology available when our patients is so widely spread. And in itself being such a big stage, our patients are everywhere. What were some of the other questions that I was going to answer from the online team of people? They're going crazy with asking questions. I'm just trying to think about which ones have I not yet answered, David?
You've had a couple of questions, mostly coming through in relation to excess skin.
Yeah,
is one thing.
Okay. And another one actually about post-op and aftercare. So, as you've already heard, having ongoing, consistent, dedicated follow-up is important, and access to it no matter when, no matter how, and frequency is critical. But other things that we do here, they're a little bit different. We run cooking classes. We love you to get involved in things like that. This is part of the journey. It's an education. It's part of the whole process, and it's a lot of fun. So this actually becomes our pop-up kitchen. We bring in guest chefs. We've got one on the 21st of September, so everybody's welcome to that. We also will film that particular one. We run mindfulness workshops. We prefer not to film that because it's very, best not to. But all sorts of events like that we host, that we invite patients to throughout the 12-month journey. So it's a lot more than just being involved in coming along for appointments. There's all the serious stuff, but there's also all the fun stuff. We like to also get people motivated to move more, to be involved in exercise, to do things beyond your wildest expectation. So I've had patients who've been too afraid to sit on a push bike before surgery, who've taken up riding. One in particular who comes to mind, who's ridden an MS bike and gone over 100 kilometres, and before surgery, there's no way he would have got into Lycra or sat on the bike, and now seeing what he's doing is just fantastic, and that's just one example. I've seen a 53-year-old lady walk the Great Wall of China. She could hardly walk up the hill before her surgery. So we want you to think that anything is possible, and it's only you're only limited by your own thoughts. If you've been someone who's done something in the past, you might have been a rugby player, you could have been a dancer, if you want to go back and do that again as an adult and have some fun, we want to help you get there. So just have that as part of the vision. And we do like to get involved. As a team, we do all sorts of fun things. This year we actually walked the, I think it was 71 floors of the Q1 building as a team. But you know, we might do something that's a walk or a run or something at the Gold Coast Marathon next year. It might be anything, but that's part of what we like to do. Encourage you to live outside of those, of where those boundaries are right now for you. All right, I think we might move on to Brianna. This is Brianna's very first appearance as our dietitian, and I'd like you to welcome her. She's doing such an awesome job here.
Thank you. So I am relatively new to this role, so forgive me if I have to look at some playbooks throughout it. Ask away if any questions in the meantime. So I guess I'm here to talk to you a little bit about what I actually do throughout the day and how I can help you to achieve your goals. Yes. So overall, my job is to optimize your health and your weight loss prior to and after surgery for the long term. For the long term, and that's what I really love about this practice and of everybody. We want you to be able to meet your goals. We want you to be able to improve your quality of life, and that's what we're here to help you do. So before surgery, I do a comprehensive assessment. We talk to you and get to know you. Basically, we want to try and identify any additional factors that are going to impact on you pre-surgery and post-surgery in the long term. So they might be your dietary beliefs, it might be cultural background, it might be psychosocial issues such as motivation, non-hungry eating, the economics of food purchasing in the house, and who does food purchasing, who does the food preparation, and how that will translate post-surgery as well. And we work with you to set those two results. Pre-surgery and then help you under 2, 3 or 4 weeks prior to surgery to prepare your body for surgery. So hands up if anybody has heard of what's called a VLCD. So a very low.
Brianna, can you speak up a tiny bit?
Sure.
Sorry, just for the.
So a VLCD.
Someone just called you Rihanna. I'd be flattered.
During the week as well. So VLCD basically is a really low calorie diet, so under 3,500 calories. And its purpose is to help prepare the liver for surgery, and I'll talk a little bit more about that shortly. After surgery, so you're required to change your eating styles quite significantly, and I can assist you through all of those stages, and we'll talk about that in a lot more detail shortly as well. So basically, my goal is to get to know you. So I want to tailor a plan that's going to work for you, and one that's going to help you recover post-surgery. So I'm going to help you get on track with your health and help you. So as you've already heard from other team members, we have the gastric bands, the Morbira balloon, the sleeve gastrectomy, and the bypass surgery here. All the weight loss surgeries or procedures work because they can cause you to feel fuller for longer. And they allow you to eat smaller volumes of food. And because of all of those reasons, we get a reduction in the food intake and then weight loss is achieved. So it doesn't matter what procedure you're having. When we first meet you, I'm here to do an assessment and help to you to get a little bit of that background information and find out what your current eating habits are like so that we can tailor something that's going to fit into your life. I think that's important. So whilst they're all different, there are other necessary lifestyle changes that are required to help you meet your weight loss goals. So surgery alone, as Matt said, is just a tool. So we know that people who do engage with the support network around them often have greater success. So we're here to help you, users and abusers. Call us every day, email whenever you've got questions, just let us know. We're only too happy to help. Okay, so I'm going to talk a little bit about the balloon first of all. And basically, as Matt said, it's a space filler. So as you've seen and had a bit of a feel, you can see how big it is and imagine that sitting in your stomach and how much weight that would take up. So it convinces the brain that your stomach is partially full. Okay, so there's already something in your stomach and it's taking up space and weight. So we look at a pre-insertion diet. Okay, so we want to prepare the stomach environment to accept the balloon. The stomach will try to digest it. Okay. And I won't lie, the first 24, 48 hours aren't fun because your body is trying to get rid of this foreign body. Okay. And then it goes, okay, it's here to stay, let's deal with it, let's go. And then things tend to settle down after that period. But we do need to prepare the stomach for the insertion. So that's typically done with a fluid diet. Okay. So we do clean fluids and full fluids. So full fluids for 2 days and then a fluid diet. So can anyone think of what might be on a full fluid diet? Shakes might be an option. Yeah. Juices, fruit juices, vegetable juices, V8 juices, drinking yogurts, smoothies, glass of milk, soups. Okay. And then we move to more of a clear fluid diet. So what can you think of that might be clear fluid? There's not much. Clear soup like rocks, yep, that's a really good one. Tea. Okay. Apple juice, so something that's drained. Okay. Post-insertion, we need to then teach the stomach how to digest around this new foreign body that's in the stomach. And that can take a little bit of time. We need to teach your stomach how to contract and push around the balloon. So typically we do 2 weeks of fluids. Okay, that can be any fluids. We then do 2 weeks of puree, and then we do 2 weeks of soft and moving up to near one texture food. And I'll speak a little bit more about those stages shortly. Okay. It is so the balloon comes out after 6 months, but we do offer a 12-month program. Okay. And so we don't want to have it out and wait goodbye. We want to stay involved for that additional 6 months. We want you to implement everything you've learned over the initial 6 months. And some people have a lot of anxiety about that period. It's coming out what's going to happen. And that's the most exciting part. And we included in your package is some metabolic and exercise testing. And that's really exciting as well. We're here to help you and get you back on track in those 6 months, implementing everything you have learned. And that's where the multidisciplinary team environment here is crucial. Okay, so we'll move on to the sleeve gastrectomy and the bypass pathway because they're very similar in terms of the nutrition component of it, like the surgery. So as Nat spoke about, we lose about 80% of your stomach throughout the sleeve gastrectomy. So if you imagine your stomach being quite a large storage pouch, we've taken that away. Our stomach usually churns food and mixes it round and round. Our body with your tube, that's very similar to a banana, will squeeze and push food down in your stomach. So we have to teach your body how to do some of that digestion because of the mechanical change. And that can take a couple of weeks. Okay? So we do that through a texture modified diet. And again, I'll talk about that shortly. Basically, your stomach isn't able to hold as much food as it used to. And you will feel a lot more satisfied earlier on smaller quantities of food. And that's why it works. Also, in the part of the stomach that's removed is the part that contains the hunger hormone called ghrelin. Has anybody heard of that one? No. So ghrelin produces the hunger hormone. Yeah. So people often have a really profound appetite loss following surgery. Okay. So by me calling and saying, have you eaten, have you drunk, people can often forget really easily because they don't feel hungry. So skipping meals can happen, and not what we want to happen, but there is that profound loss of appetite. And over time, it does return, but not to the same extent as what it was prior to surgery. So it's again a tool that can help you with your weight loss, and it helps you in the two ways: helping you feel satisfied on a smaller amount of food, but it also helps with the appetite suppression as well. So this restriction in food leads to a reduction in total energy intake, and that's what can help with the weight loss. So your body is forced to use its own stores and its own energy. So as I said before, the diet prior to surgery is a BLCD. So has anyone tried a BLCD before? And, you know, a few people in the room, I'm sure a few people online would have as well.
Can I actually step in and ask a couple of the questions for the online people?
You sure can.
Okay, sorry, excuse me.
All right, so one of the questions coming from online is, and I'll actually answer this one, but then I've got another one for you. For Hayley, she is 3 hours in a remote location. What are the options for getting her pre-op diet to her? We will arrange to have it delivered to you, so you don't have to worry about that. Question about pre-op diet. How long was probably the most common question there. How long do you have to go on a pre-op diet for?
So that really depends on your starting weight and BMI. So it may be 2 weeks, it may be 3 weeks, it may be 4 weeks.
Thank you. Is there more about the pre-op diet?
More a case of, do they actually need to have shakes, or are there other things that they can eat during the pre-op diet?
Generally, it is a shakes diet. There are a couple of other things we can include, and in some circumstances we can use an alternative, but generally we get the best results through the shakes and meal replacements. So what is a pre-op diet? I guess it's a big question there. So it is meal replacements 3 times a day to replace your meals, so breakfast, lunch and dinner. Okay. We also are allowed to have a small piece of calorie controlled fruit at morning tea and afternoon tea. And we are also allowed to have, from our allowed list of foods, 1 to 2 cups of free vegetables at lunch and dinner. We also need the inclusion of 1 tablespoon of oil. What does that all look like? I'm just rattling off food. What does it all look like? So, you know, I'm sure you guys understand your fruit. With your free veg, you know, what I suggest is make up a really big salad at lunchtime and take it to work, using all of those free veggies. Put a little bit of balsamic and olive oil in your salad as your dressing, okay? And then have your meal replacement as a side. At dinner time, you know, make up a big batch of stir fry with all of those free veg. Stir fry it in, you know, and there's some condiments on the list as well. Stir fry it with a little bit of garlic, soy sauce. Give it some flavour. Box and stock cubes are okay. So you fry some garlic and some onion together, add some stock cubes and water, and add all of those free veggies to it. Make up a miso soup and fruits and those Asian greens. You know, we've got ideas left, right, and centre on how we can actually make that achievable for you. The other couple of things to mention on the pre-op diet is the 2.5 litres of fluid a day. Fluid from water. No juice, no soft drink, no alcohol, no smoothies. Okay. None of those ones that really have any energy in them. Okay. There is a little bit of diet coffee or any of the diet products, but generally it's good. Fiber can be an issue on the pre-op diet. Again, talk to us. There's no harm in using a fiber supplement. We can suggest something if it is an issue. And a multivitamin. So generally, from this get-go, we get you on a multivitamin so that we can prepare the body and just generate a few more stores prior to surgery.
What sort of vegetables?
So
Like the
anything,
greens and that sort of
anything
thing?
that's basically low in carbohydrates. So anything other than parsnip, potato, sweet corn, sweet potato. There's plenty of documentation that you'll get. So that's the pre-op diet. Any other questions online about pre-op diet?
Before you go on,
Yeah.
I'd like to know why you've got to have that diet.
Yeah.
Because I know it's good for liver, I know
Yeah.
why, but a lot of people don't understand why it's gotta be done, and they will cheat it if they think they can.
Yeah.
But once they know why they've gotta have it done, they don't feel cheated and stuff.
So our liver actually sits quite closely to our stomach. Because most of these surgeries are done laparoscopically, we need to see inside the stomach and we need to be able to move the liver to do that. So the instruments that the doctor uses to move the liver out of the waste can vary depending on the size of the liver. In order to move the liver out of the way, we can see the stomach a lot better if we can shrink down the liver a little bit. Okay? The liver generally holds a lot of fatty tissue around it. So we can reduce the liver by about 25% by going on this very low calorie diet. Okay. So basically to reduce any of those complications during the procedure.
And I'll just tell you guys, I was very lucky to be able to go up and watch our doctor, watch our doctor perform the surgery. And the gorgeous Erin, who's also one of our dietitians who comes in and fills in and helps Brianna sometimes, was with me. And we saw these beautiful livers and she got very excited. It was quite funny. So there is a really big reason why we do it, because they just literally hoik it out of the way. And that's the big thing. If it's too big and too fatty, he can't get it out of the way, he can't do surgery. So it really is one of those things that we saw that and that was quite exciting. So I thought I'd tell you that.
It's not because we just get joy out of putting in little diet. It is really important to make the surgery as safe as we can. Okay, so let's talk a little bit more about the diet. Fluids. So fluids for 2 weeks, purees for 2 weeks, and salt for 2 weeks. Okay. Why do we transition through these stages? Okay. So I guess surgery initially is really restrictive. And you need to go through all of these stages so that we can move back to normal food. So as your new stomach recovers, we will be able to eat 3 meals and some snacks throughout the day, but it will take time to get to that point. Okay. There's a lot of swelling and a lot of healing that needs to occur. As Nat spoke about, we don't want any leaks. We don't want to be putting any undue pressure on your new stomach. Okay. We need to teach it how to digest food using its new structure. Okay. So the fluid stage is important to allow healing and not put strain on that stomach. But we still want to meet your nutritional requirements, remembering that you're not going to have an appetite, you don't feel like eating. Okay. In hospital, you'll be on a clear fluid. I've already spoken about what clear fluids are. When you come home, until you hit day 14, you'll still be on fluids, but they can be any fluids. Okay. I still encourage patients to have something nutritious at breakfast, lunch, and dinner. Okay, so that might be a meal replacement shake, it might be a soup, a thin down soup that can still go through a straw. So the definition of fluid, it must go through a straw. I go through a straw, can't have it on that diet. And then in between, sipping on other fluids. So that's utility juices, vegetable juice, fruit juice. I try to get people to have about 1 litre of nutritious fluids and 1 litre of water. Totally 2 litres. 2 litres and minimum. It'll be easier said than done. Sipping constantly, you won't be able to go. You don't have that storage capacity anymore. Really slowly sipping constantly all throughout the day. Have you got a water bottle beside the bed? Have you got a water bottle at your desk, in the car, in your hand? They're all going to be the prompts that keep you hydrated throughout this. During weeks 3 and 4, we move up to purees. So the definition of purees, very smooth, thin consistency. Okay, so think about mashed potato consistency. Again, we want to teach the stomach to be digesting something a little bit more solid, but not a soft food. Okay. So what are our purees? I try to encourage people to choose something from all of the core food groups. Okay. Things like pureed fruit, pureed vegetables, pureed casseroles. Anything with added moisture is going to puree up well and slow cooked.
Can I, okay, I think Sandra online is a little bit confused. Sorry, excuse me. She's asking, why does she have to drink so much? She works at a job where she can't go to the toilet all the time. Sorry, Sandra, but don't be freaked out. It's not going to happen. You want to go with it?
So we basically want to stay very well hydrated and meet your nutritional needs with your nourishing foods and your water intake. Okay. In the first couple of days of increasing your food intake, and don't forget your food intake is going to be higher up in the pre-op diet. We probably will be going to the toilet a little bit more often, but once your body does adjust to that, it normally does scale back down again, even though you are having the additional fluids.
Okay.
Any other questions at this point? Good. Purees. So when we get up to fruits and vegetables, protein, what kind of purees can you have in our dairy food groups? Yogurts, smoothies, yep, custard, things like cottage cheese, mashed avocado, or like pureed avocado, add a little bit of liquid to it, make it smooth.
Don't puree baked in it. Tastes disgusting for a start. And it doesn't work.
Often by pureeing things, if you puree them separately and you've still got them individually on your plate, it's going to be a lot more palatable and visually appealing rather than anything like a big bowl of mush. And just a little tip to keep your body down. So again, this allows your new stomach to heal without causing any additional strain, but we're also learning how to digest a little bit more in with different textures of food. Weeks 5 and 6 see you transition up to soft food, and basically that is a transition from purees to a normal textured diet. So the definition of soft is anything that can be cut with the side of a fork. Okay, so cooking those veggies for a little bit longer so that they can be cut. Really slow cooked meats, poached fish, mashed up baked beans, soft pears, grapes, watermelon, really soft veggies. Your custards and your cheeses, you can go up to normal cheese in this one. Yogurts, they're all still fine. Things like a risotto or porridge or wheat bix, they're all okay. So basically a normal diet, but just cooked a little bit differently so that we can make it really soft. Think about leg cheeks coming off the bone. Think about pulled pork coming off the bone. Really soft. Okay. Any questions so far?
No, we're still going. Yeah, that question before about water was because she couldn't quite hear you and she thought you said that she had to drink 5 litres of water a day.
Oh, goodness, no.
Yeah, no. There you go. All right.
I'm nearly done. So the weight loss generally occurs in the first 12 to 18 months. Remember, it takes time to teach your new stomach how to adapt and learn how to eat and drink again. The wonderful thing about the programs here is that we stay in regular contact with you. So we know that people who do have that follow-up tend to be more successful in their weight loss journey. It's important to establish those long-term goals.
Thank you very much, Brianna. Your final time with Brianna, absolutely invaluable. Can I just say that was a very first presentation. None of us are public speakers. It's a hard job to get up here and speak in front of you, so well done. Those online who couldn't hear everything Brianna said, don't worry, you will get so much one-on-one time with her. You will not be able to shut her up to get stuff. So she'll be able to share with you such a wealth of knowledge. It's never ending. There's so much knowledge to share from the dietitian. If you've ever had an experience with a dietitian in the past, I promise you this will be entirely different to anything I've ever had the opportunity of experiencing in the past. So get the thought of what your past experience of working with a dietitian might have been like. This is really different. It's very specific. It's very unique to dealing with as far as post-surgery. And the most important thing is connect to the dietitian who works with you. Research is probably one of the most important people you will have on your side to work with long term. All right. There was one special thing I was going to mention. I remember I'm just thinking so many things online. Does anyone have any questions about how the program works? Anything that you've covered that you're not sure about? Yeah, sure.
You're talking about drinking water that you all the time.
And a lot of people ask about alcohol. I haven't had that question come up yet tonight, but if you're someone who enjoys a drink, you can still enjoy a drink, but you might not be able to drink quite as much as you have in the past. So, very, very different from previous behaviour, but it doesn't change your ability to enjoy a normal social life. And the same with eating. You can still enjoy a normal social life, you're just eating less. So I don't think that's not going to be a big part of your life. It's fascinating listening to sleep patients talk about how they change. I've come across people who, Brianna was talking about mashed avocado. I speak to people who've never even tried a mashed avocado before surgery and they love it, or they've never eaten salmon before surgery and they love it. Salmon, tomato, avocados, and salads. So that might sound weird, but your taste buds do change, your desire for certain foods change, and your heightened sense of taste changes a lot. So I'm not sure that Brianna mentioned that spicy food can be a lot spicier. Sweet food can be sweeter. So it does change your desire for certain foods. If you're a sweet eater, you're likely not to be, and that's probably one of the reasons why the sleeve is so effective and also so efficient in helping patients with diabetes manage their problems too, because your eating behaviour changes so drastically.
Is that a good patient, or is that?
Look, you can people still like a square of chocolate, you know. If that's what you love, you can still have it, but you don't feel like you don't actually want to have it all the time. We have a private patient support group on Facebook, and I hear people talk about the fact that they still love to have chips. Chips is a really common thing, like a packet of potato crisps. They can still eat them, but they're not going to eat a whole packet, but they still enjoy all of those things. So, you know, still having those things that you love, they're still part of life. And that's one of the, I think, great things about the sleeve is your ability to still enjoy a whole range of foods, normal social life, go out to dinner with your friends, have a barbecue at home. All of those things are still normal. It actually, to me, in a way, normalizes behavior, but you're reducing portion size. It's teaching you to eat breakfast, lunch, dinner, morning tea, afternoon, and supper, and which is obviously going to work on improving your metabolic function as well, but still enjoying good food and good life. Yes, question.
There's a couple of really big questions coming through. First up, what about Coke or fizzy drinks is one.
Yeah, well, Brianna will tell you probably no. First of all, they're not good for you. Where's the nutrition in a can of Coke? I tend to refer to Coke as Drano. Sorry, Natalie.
Sorry, everyone. I have
everybody has
one can a day, and it's embarrassing. I go and sit in the lunchroom and drink it by myself.
So to me, Coke is Drano, and the only time that we ever recommend to any patient to drink Coke is typically if they're a band patient and they've eaten something they shouldn't have and it's got stuck. The best way to actually release it is to drink Coke. It's like Drano. Don't drink it. It's not good for you. It's full of sugar. It's full of caffeine. There you go. Have I spoken normal English, Brianna? Am I on the right track?
Yeah, look, we want to save the room in your tummy for the really nourishing food.
Yeah, save the room for nourishing things.
Something that's going to provide your body with a little bit more than just bubbles.
Yeah.
But in saying that, we say definitely none for the first 3 months post-operatively.
Yeah.
And if you would like to try it again, you can at that 3-month mark, being aware that not everybody can tolerate it.
Yeah. Did we get that? No bubbles for the first 3 months, and then you can have a little bit, but probably not too much. Yeah.
And another question, it's probably you'll cover later a little bit, is a lot of people are asking about, is the sleeve the most common surgery done? And a lot of people are actually asking what is best for them. And what's the best way for them to find out what is best for them?
The beauty of having a full service bariatric surgical clinic is that we've come such a long way in the last 16 years. 16 years ago when we first started, we only had the gastric band. That was it. It was a one size fits all. Now we're actually really lucky that with this team of people, we can assess each individual based on their medical history, their geographic location, their needs, their goals, and a whole range of different things that help us to help them determine best procedure for each individual. So we are able to really individualise a program now and select for you the best procedure for you. Yes, the sleeve has become the dominant, most popular procedure in our practice. It would definitely be the #1 procedure of choice. And look, that's just based on results. You know, it's grown over time to be such a successful procedure, and it achieves the most incredible outcomes every day. So yes, it is the most dominant procedure, but for amazing whole range of reasons, and we absolutely do love it. So that's probably a good answer to that, I hope.
Yeah, and something else, I don't know whether you'll be addressing it later, but there's a lot of people asking about costs and superannuation and Medicare and all those sorts of nitty-gritty
I'll
questions.
answer that really quickly now. Cost, I know, is a big question. #1, this is a clinic that does not discriminate whether you have private health insurance or not. Our belief is that these procedures should be available to all people no matter what. I know there's been chat online about why doesn't Medicare cover it. Unfortunately, I've been on my soapbox for many, many years and tried to influence and break down those barriers to see that this is something that is more available in the public sector. I'm not able to do that, but what I can do is help people who come to us find a financial solution no matter what, if I can. So there are a number of options. If you've got private health insurance, you must have top hospital cover. If you cannot cover the out-of-pocket expenses, then we can use early release of funds to serve the gaps, or we can look at finance plans. If you're a self-funded patient entirely and you've got to find a way to cover your surgery, we find the best solution is to help patients who are eligible, relevant, and in a category where this is a life-saving surgical procedure, access their superannuation. Kelly, who's behind our desk there, hiding there, who is often the first person that anyone talks to here, she spends probably over 70% of her time just supporting patients manage their super applications. What better way to access surgery? It's your money, and it's going to change your life. And if you want to be there to enjoy that time in your life, do it. I think it's the best thing we can possibly do to assist patients access surgery when we know what it's going to give them down the track. This is quite interesting, it took me 10 years in this industry before I ever learned that patients are actually changing their financial health and well-being as well as their health and well-being. Now that might sound really strange, but I see people who, and I've had patients come up here and talk on nights like this about the fact that they've had the self-confidence to turn their lives around and go for jobs that they would never have gone for in their wildest dreams. So, you know, changing their financial future is also potentially a long-term outcome. But does that answer some of those questions? Do you have questions about finances? How it works? Anything? No? We're happy. We'll give you any estimates of fees and all that information is available to you tonight. All right. Questions? We're good? All right. We're slowly getting to the most exciting part of the night, so hang in with us because we've got these two awesome people down the back there who look like they run a support group as well, so they can be busy talking to people online. But before we get to them, I really would love to introduce you to our psychologist. Before I do, 16 years ago, the psychologist team member was a bit of a taboo word to mention. When we used to tell people that they had to see a psychologist 16 years ago, they would say, why do I have to see a psychologist? These days, that attitude changed so much, and I think as a society, our attitude towards the role of psychology has really drastically changed. It is such a valuable part of what we offer. Giving you the chance to build strategies and goals for the future that make up part of your healthy profile is all about what do you gain from working with a psychologist. It's endless. The opportunity once again is there for you because it is an unlimited support program for you to access the two psychologist team members that we have here.
Tonight, I would like to introduce you to Warren, who's been here as a psychologist now, working in this industry for, I think, over 8 years, and has made this a real specialty role for him in managing bariatric patients. Please make him welcome.
Good evening, everybody. I'm just listening to some of the comments from our other team members, and I think probably the one thing that sort of stands out for me the most with this whole process, and it's something I have to remind myself of every now and again, is that what you guys are essentially surrounding yourself with are people who understand your situation, who are aware of your challenges, aware of what you're trying to achieve, and they also understand some of the pitfalls. With, executives understand what it's like to fail, they understand what position you're currently in, whether it be in your job, in your financial situation, your family situation, and so collaboratively, we're here to support you, and you'll probably quite quickly realize when you make the decision to have surgery, whether it be gastric pain or gastric sleeve, or whether you have something like a gastric sleeve, which is a non-surgical procedure, that you're going to get comments from people out there, especially if you start to share your decisions and your goals and your aspirations. And some of those comments are not going to be positive. You're going to be negative, or not.
Do you really need to do that? It's so drastic. You can do it on your own, and so you probably heard of those things.
Another one that they tend to come up with is you take the easy way out.
Yes.
This way, under no circumstances is an easy way out. A diet's an easy way out because you can run that diet anytime you like. This you can't.
Yeah, absolutely right. So, and you're going to get them, and I think what we want you to do is we want you to feel like you have a support network here, regardless of what comments you get from people out there. And I can tell you now that they generally come from very same field, so to speak. Most of them who do make comments, if they are negative, perhaps don't have the resources, so they may not have the financial resources, so they've never really investigated it. Or they may not be supported by somebody at home. So, for example, they might have a husband or a mother or a father who's not supportive of their decision, so it really sort of goes against their decision, so to speak. It puts a lot of negativity or a lot of negative thoughts in their head in terms of the decision that they're making. And then there's other people out there who don't really know much about the procedure. They've never actually done the investigation themselves. And I can tell you now, there's a few GPs and doctors out there who feel the same way. So, and perhaps it's because they themselves have never encountered weight problems. Perhaps they've never been through what you're going through. They've never understood those challenges. So working with us, and particularly with me, is about overcoming some of those potential negative thoughts. What are the strategies we're going to take on board? Are we going to tell people? Are we going to be open about it? At the end of the day, my philosophy is that you should share your goals and your aspirations. It's not about weight loss, it's about you improving your quality of life. And, something that somebody else has a negative comment about it, perhaps you shouldn't be spending much time with them at all. Okay, so surround yourself with people that bring about a positive influence and give you the support that you need, with the decisions you make. And so part of you spending time with me is coming to spend roughly an hour with me to talk about family dynamics, who's in your life, who you're living with, what you do for a living, what your work-life balance is like, what your capacity to exercise is like, what's your understanding of the procedure and what to expect, how's it going to affect your behavior in a social environment, in a personal environment, how's it going to affect the family dynamics in terms of what everybody else is expecting. The thing you need to remember when you come through this process is the environment that you come from is the same environment you're going back to. Okay, just because you have surgery doesn't mean you walk out into this wonderful world, where everything smells nice and looks nice and it's just, full of inspiration. You're going to go back home to potentially some challenges. You're going to have challenges that perhaps you didn't really think would be a challenge. You might be engaging with people who you thought would be very, very supportive, only to find out that they're actually not. So they become a negative influence. If you look at any sports profession or anybody at the pinnacle of their sporting career, they surround themselves with the right people. They don't go to Rio with the wrong psychologist or the wrong nutritionist or the wrong physiotherapist. They go with everybody to maximize their potential, maximize their performance, and that's what you need to do when you come here. Okay, so the family dynamics are very, very important because you can go home potentially married to the same person if you're married or in a partnership, probably doing the same job, right? And with the same children, same house. And if you open the pantry, you're going to find some of the same foods because everybody else lives there too. Okay, so they're going to expect to have a certain thing. You have to learn how to manage all that in the midst of going about what is generally for most people, because sleep is available enough and has been for the last 4 or 5 years. Right? You're going through something that's permanent and not reversible, and you want to know that this is the last thing you ever have to do. And that's my job, trying to help you make this the last thing you ever do. It's not the easy way out, right? But it is something that works, right? So my biggest sort of argument to a lot of people who say this is the easy way out. Why would you keep doing something that doesn't work? At the end of the day, if you keep dieting, there is a I suppose a potential for a diet to work. For somebody who's not carrying a lot of weight, they can certainly rein themselves in and can get some good control. But once your BMI gets over 30, I can tell you now that you are more likely to gain weight than you are ever to lose weight. And unfortunately, it comes with a lot of risk as well. So your likelihood to develop type 2 diabetes and high blood pressure and sleep apnea, that goes up 40% as soon as your BMI hits 50. So you can imagine what a difference it makes when your BMI hits 40 and 50. Okay, you start putting yourself at risk. So I want to know everything about you. I'm not there to judge you. I'm not there to make, even though I do have to sometimes say, look, this person probably could do with more pre-surgical support to make sure that the timing is right for this particular procedure. Generally, in most cases, 99.9% of the time, everybody's suitable to go through the surgery. It's about finding out what sort of level of support do they need. How are we going to manage this journey together? Because I know all the excuses, and I know all the potential behavior changes that you're going to encounter, and I know all the comments that you're going to hear. So my job is to give you some insight as to what this journey is going to look like for you, so that you walk out of here, more educated than when you came in. So that you kind of don't make the right decision. This was the decision that I made. And I'm sharing my goals with the right people, because the great thing about sharing your goals and aspirations about what you want to achieve, right, is that you're now obligated to. You hide behind them and you don't share them, well, you get to do whatever you like, because nobody really cares. But you do need to surround yourself with the right people, and you do need to let them know what you're doing. And you have to hope that they'll be supportive. Then you're obligated. You're obligated to live a certain way. And if you live a certain way for a long enough period of time, it becomes a natural habit. So we'll talk about that. We'll talk about eating habits, work-life balance, etc. And then I'll see you about 6 weeks after surgery. And that's a really good opportunity to get together again quite early in the journey to make sure that you're adapting well. You understand your weight loss, you understand from a percentage point of view, and I'll do all that with you. So I'll go to your percentage, and I'll look at your percentage on a worldwide scale. How does it marry up with what we see internationally? Are you ahead of the game? Are you behind? So we'll look at all those things, but I don't want that to be the emphasis of what we do. The emphasis is not about weight loss. The emphasis is about behavior change. Once a surgeon has done his job, that's it. You don't really need to see anything. The rest of the responsibility falls on us. And when it comes to behavior, right, that's kind of my job. And unfortunately, for the rest of your life, that's your job too. That's your responsibility. Okay? So it all comes down to behavior, any which way you look at it. Whether it's eating less, eating at a certain time, eating a certain type of food, exercising or not exercising, looking in the mirror or not, standing on the scale or not, that all comes down to behavior. Right? And there's certain things I don't really want you to do, and I, for one, don't want you to step on the scale. And I don't want you to diet, because diets don't work. I want you to be focused on the positives about what nutrition you get from the very small meals you feed yourself. Place the emphasis on what you need rather than what you shouldn't have. Okay? Because dieting is built on restraint theory. Restraint theory doesn't work. It's been proven over and over again. Okay? So 6 weeks we'll see each other again. That's your first visit. And bear in mind that there's some generically scheduled visits because if we have to, we're going to drag you back in here, whether you like it or not. Okay, because we don't want you going missing and we don't want you feeling like you have to try and do this on your own. And one of the reasons I don't want you stepping on the scale is because there's certain theories that I sort of adhere by in terms of how you're going to get your results. Surgery does a certain amount, and I have to help you understand what's going to do the rest. It comes down to consistency, and we need to find that consistent balance to help you achieve that. Yeah. So 6 weeks is a generically scheduled visit, so is 6 months and so is 12 months. So you know you're going to get 3 visits. I'm going to drag you in there whether you like it or not. All right? And then the rest of it's kind of up to you as to whether you want to see me or how. But at least I know that I've done everything I could to get you in and give you the information I need to give you. Most of you will do well. If you have any gastric sleeve, you will do well by default. You will do naturally quite well. I could probably leave you on your own following gastric sleeve surgery, and you'll probably at least lose 60% of your excess weight. Okay, so the challenge is most people will lose more than 60% of their excess weight. They will lose 75, 80, 85, and potentially go up to 100. Okay? And you can't do that through surgery alone. Yeah, I've been doing this long enough. I've seen enough patients to know that it doesn't work like that. Okay, all right. So 6 weeks, 6 months, 12 months, and any other time you want to see. Okay. All right.
The most valuable thing I can add to engaging with the psychologist is you're investing in it, make the most of it. Choose to actually go the whole way and make the time to, to really make it all about you. Just a couple of questions from the online people. Margaret lives 1,000 kilometres away and was worried about how she's going to manage pre-op consultations before surgery. So you can do your pre-ops via Skype and phone, and then only have to travel once to the Gold Coast and Brisbane. You stay 1 week locally, and you'll repeat your appointments face to face before you actually have surgery. That was one question. There was another one.
We have 2 psychologists.
Sorry, we have 2 psychologists. Yes. I did say so.
Okay. So.
A lot of people were asking about, because they couldn't quite hear the dietitian part, and you'd offered some.
If you've missed part of the dialogue and you couldn't hear it, I'm sure Brianna would take some one-on-one phone calls as well, so that's not a problem. Happy to help. All right. Any questions over here at the moment? Questions? Everyone's happy? Okay, we get to the most exciting part of the night tonight. And this is something that I think, we're incredibly lucky. We have a very generous group of people. Every single month we have someone different who's willing to stand up and share their story. Often it's someone who's been at our desk 12 months earlier, hiding behind a cap, and who said to me, I'm never going to be one of those people who stand up in front of the crowd. They're usually the ones who can't wait to tell their story. And I love nothing more than having such a wonderful group of people share their stories. Tonight, this is a really special occasion. Nick and Karen, there's so many lovely things about them. Number one, being a husband and wife and supporting each other through this journey, I think is just spectacular. And we've had all sorts of dynamic combinations in families with husband and wife, mother and daughter, whole families, whole workplaces actually, who've been converted into having surgery. But not only have they supported each other throughout the whole journey, but they've also decided to support others along the way as well. Started up their own support network and there to answer questions from a patient perspective, which I think is just fantastic. They were going to come and join us quite some time ago, but Karen had some issues with injury, so we're really excited to have them here. They're both post 12 months. They've got lots of exciting stories to share. They won't be able to share all of them tonight because we won't let them, but we can always have them back to share more. But please make them both welcome, Karen and Nick.
We'll start with a little bit of a visual.
That's 20 kilo. Just over 12 months ago, I was carrying 4 of them.
And I was carrying 2.5 of those.
Makes everything you do during the day a whole lot harder.
Over 12 months ago, we were sitting where you guys are now. And to prove it, we've got some photos for you. So we thought we'd get some visuals happening. Hang on a second. So there are our prior to surgery photos, if you'd like to share them around. That was us over 12 months ago. I was 113 kilos when I first went under the knife.
I was 180.
And we didn't think we had a chance in hell of standing here in front of you today looking like we do.
No chance.
I haven't been this size since I was in primary school. And I honestly, I would have been happy to get to 75 kilos. I weigh in at 60.
When I first came to the appointment, I had no idea what a gastric sleeve was. Not a clue.
We just sent him.
Oh, I knew it was going to help me lose weight. I was dragged here by Mum. She took me in. Otherwise, I probably would have chickened out as well.
I was away at working on site out of mine, so I couldn't be here to support him. So
I came here, had 3 appointments, a seminar that you're doing now, come away with a date and going, what the hell did I just do? 12 months later, it literally saved our lives.
it has. And I was going to wait 12 months, but after he had his surgery, he said, no, we're going ahead, we're doing it now. I'm insulin-dependent diabetic. I was diagnosed in 2009 as a type 2 diabetic. I went on to insulin straight away. I stopped taking my needles probably about 2 to 3 months after my surgery. I had my second HbA1c, which is anyone who's a diabetic knows that it's 3 months of blood. And my doctor's cleared me. I am no longer insulin dependent. I'm no longer diet or tablet controlled diabetic. She said it's as if I'm not. It has literally. So there's our surgery along the way photos. We've had some ups, we've had some downs, we've had some all over the places. But we thought we'd show you another really good visual. We got married in 2009. I had my wedding dress made to fit because I couldn't find one. I put this on today and we couldn't stop laughing. So, hang on, I need your hand to hold this. So this is the first time I have put my dress on again since I got married. My boots are in the way. I did it with no shoes on earlier. So in 2009, this fit perfectly when I walked down the aisle. I can nearly fit 2 of me in this right now. So, yeah, it works. It's absolutely life-saving. It does work. One of the sad stories, this is Michael's suit, by the way. I pulled this out today and he went, holy hell, I actually wore that. There's a photo in up there of Michael standing in a pair of jeans. He's got both legs in one leg of the jeans. They were the jeans he wore on the day of his surgery.
And that photo was taken less than 12 months.
Hey, help your life.
I'm selling my dress, by the way. I think I need it again. So yeah, so we thought we'd start with some visuals to give you some ideas. We did have one sad story. We have had a pretty rough time. We lost everything due to family issues and a lot of things. We went to New Zealand where we hit rock bottom. And the saddest part of our story is we both decided to try and take our own lives. However, the upside of that is while I was being resuscitated in the Westpac Air helicopter, I would not have been able to be resuscitated had I not lost the weight. That saved my life twice.
Saved both of our lives literally that day. Neither
We
of us
wouldn't
would
be
be
here.
here. Now, come away from it, totally different people. We're a lot stronger mentally, physically. Once you've hit rock bottom, there's nothing can scare you.
And don't get me
It's
wrong,
only come up.
the surgery wasn't what dragged us down. Surgery is what saved us.
Definitely.
So we've got nothing but good things. And we also went into it with a good attitude too. We decided that it wasn't going to be the solution. It's a tool. And we went in as a tool. We still had to change our diet. We still had to change our habits. We still had to change the way we looked at things. And we did that. And with the knowledge that it wasn't a cure, that it was a tool, we have been able to stand here in front of you today. And we've worked hard to do what we've done.
And even though they've told you that you're going to lose that appetite, and that you're sitting there and up in your head, you're thinking, no, I'm an emotional eater, or I eat all the time. It's in my head.
It is. So
I thought too. And when I went into surgery, all I wanted to do was eat. I would have killed somebody.
Bear with a sore head.
But when I woke up until just recently, nothing, no hunger, no wanting to go eat the wrong things, nothing.
We had our niece living with us, 15-year-old girl. She had to remind us to feed her.
Is how important it is to remember to eat, is that because you don't have that appetite to remind you to eat, if you got a busy day, it's very easy to forget to eat.
And it's very, very important that you do protein, 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 protein. That's the biggest thing for us. We were very, very lucky to have a friend who makes Punish Nutrition. He has helped us along the way. He has given us all the tools that we need as far as that's concerned. Your food, your taste buds definitely do change. There's a lot of things that we wouldn't have eaten that we do now. There's a lot of things that we used to eat that we don't. The night before my surgery actually was the last seminar we attended in Brisbane, and I was as nervous as anything. But yeah, that was the night before I went under the knife, and I haven't looked back since. It has been one amazing journey, and I can recommend it to anybody, and I will sing it from the rooftops. And I have.
12 months after my surgery, I went to SeaWorld and went swimming with the sharks.
On his anniversary day.
In a wetsuit. Before, there's no way you would have got me near the water. I'm afraid Greenpeace were going to push me in the water.
Was that, Mick?
If anyone hasn't seen
Was that a goal that you'd set yourself before surgery, that you wanted to get to 12 months and do that?
It's on his bucket list.
It's on the bucket list.
Same as all I got to do left is ride a bull still.
It's always been on his bucket list, and his mum actually bought him that for Christmas. And I would like to say thank you to her, because if it wasn't for her, we wouldn't be standing here either. And when Warren did mention family support, you do need it. You really do. This surgery does mess with your head, and not in a bad way. We've had some ups, we've had some downs over it. We will look in a mirror and we'll walk past, and I would shock myself and go, who the hell's looking at me? And I went, oh, that's me.
I got up one morning and go to put my jeans on there and go, no, they can't buy them. They must be Karen's. Put them aside. No, they're mine.
And he came out one day in a black shirt and he goes, my shirt shrunk. I said, no, honey, that's mine.
I could actually get it on there.
And then the worst one, every 2 weeks I had to go and buy jeans, because I wore jeans at work every 2 weeks. Kmart, $7 jeans became my best friend, and the $3 rack became my best friend, because we were forever buying clothes. But he decided this one day I was having a really down day. I was in a size 18 pair of jeans, and they were hanging off me with my belt. He decided to take me to Target and buy me a new pair of jeans. And I thought, I don't know what size I am, so I grabbed a 16 and I grabbed a 14. I went into the change room, which is something that I never used to do. I would buy clothes, take them home, try them on. If they didn't fit, take them back. I was always too embarrassed to walk into a change room. So I walk in and I go, may as well get the worst of it over, so I put the size 14s on. I walk outside and I'm in tears, and he's like, oh my God, what has happened now? And I threw the 16s at him and I said, they don't fit. The 14s fit perfectly. And that brought me to tears.
There's a whole lot of non-scale victories you'll come across too. How many have been to a barbecue and everyone's got those plastic flimsy chairs, and you go, no, I stand.
Biggest fear.
Or you think about getting in that aeroplane flying and going, no, I don't know, squash a guy next to me or whatever, or the seatbelt not fitting. I had
Or
all
you
that.
have to get the extension.
That's it. You're not the only one. Everyone's had those as well. We've all
So
had.
he flies to New Zealand and I get a photograph. Here he is taking it off his lap with this massive big seatbelt out here. It was a non-scale victory. And they're the little things that make it worthwhile all the way along.
Before, if I knew I had to go clothes shopping, I knew I was going to Target or Kmart, going to place big enough to fit. But now I can walk into anywhere and go pick it up off the rack.
And I drive him insane because I shop online.
For the first time, I can actually go and go, oh no, they're actually too big. Instead of looking for the biggest pair around.
And boots. I love boots. Never been able to wear them because I couldn't fit my feet in them. My legs were too fat. Believe me, you lose weight on your feet.
Yeah, you lose a shoe size.
Yeah, but I can fit in boots. Boots, I'm a shoe person. I love my boots.
Food-wise, once we got onto the solid foods, we went to Subway. We'd ordered a 6-inch sub in flat bread only. There's no way we were going to be able to eat that one. And have that 6-inch cut in half, and we still couldn't finish it to begin with.
Blew our minds. It literally blew our minds. But the biggest thing we did was, before we had surgery, because I'm an information person, I looked on the internet, I looked over Facebook looking for support groups. And we found a few and we joined a few. And then we started to notice, people make mistakes. We're all human. Everybody's going to slip up. For example, one lady slipped up and said, I ate a piece of pizza. Well, the admins on that site, they crucified her. Absolutely crucified her. And it puts me on my soapbox. I got in there and I said, look, we all make mistakes. You're supposed to be a support group. Why aren't you supporting her? Why are you crucifying this woman for making a mistake? We should be telling her, it's okay. Everybody slips up. Tomorrow's another day. Let's start again. They kicked me off. We weren't allowed invited back. Nick answered a question when someone said, what nutrition do you use? He said, I use Punch. They didn't agree with it. They kicked him off. So we thought, what the hell? We can't find the support we need. We'll go out and we'll do it ourselves. So we started.
She goes and looks for the information. I'm the impulsive one. He goes, well, hell, I'll stake me own.
So we did. And we had 5 people come over with us that night because we were all the 5 that got kicked off that one website.
12 months later now, I think there's 650 on there.
And we had about 30 people join one night and we couldn't work out what was going on. So I texted one of them. They'd been to a Duramind seminar. And they actually told us at the Duramind seminar, I know, go figure, to go join our site. They recommended our site. We have a lot of people on our site say thank you very much because there are 2 rules on our site. One is you never judge, you never crucify anybody, and you never say anything bad. The other one is we don't promote anything that will give you a monetary value. You can give your opinion. You can say what nutrition you like. You can say what protein powders you use. You can do all of that.
But we're not Amway. You're not getting up there and selling it.
You don't sell it.
Say what works for you, because it may work for someone else as well.
So
but it's not an ego either.
no, and we're not there to sell things. We're there to give information. I'm a big believer in information is the key. I will go out and I will research anything and everything before I jump head first into it. So we figured if we couldn't find it, we started it.
Support-wise, we were living way out at Oakey at the time, so there's no way us 2 hours away. We could get in here for all our appointments, but I can guarantee you that I'm driving a truck on a Sunday, and some random thought coming through my head, and I'll be on my phone, Facebook, texting, and Felicity will answer it the same day, even on a Sunday, with an answer for me.
Dedicated team. We have recommended this weight loss surgery to probably about 6 or 8 of our friends, and they've all come through here, and they've all been thankful that we have. They're all healthy. They're all on their way to where we are now too.
That 2-week pre-op diet, that will be the worst 2 weeks of your life. The good news is that's the last time you'll ever have to do it. You'll never want to do it again.
And when she said he was like a bear with a sore head, believe her, because I was exactly the same, especially when my husband was making me go up the road and get him and the rest of the kids bloody pizza for dinner, and
Absolutely.
I couldn't eat it. Oh my God.
I'd bring her up on the phone down in New South Wales and
Yeah,
the whole
bear with
crowd
us all.
here,
And
you know,
you do,
what are you on about, you know?
lose it, you lose it.
It is, and it is like that. And because a lot of people, and like I said, we've been where you are, emotional eating. Michael was a big emotional eater. And then he would hate himself for eating, so he'd eat more. And then he'd eat more, and then it just became a cycle.
Basically,
Now-
I had one meal a day. It began when I got up and finished when I went to bed. That was it.
We've gone from that to reminding ourselves that we have to eat. And now, I had my surgery on the 13th of May. I am finally starting to sit down and go, I feel like a piece of fish. Or I feel like something. So it's only just starting to come back to us, that urge to eat something or to want something.
There's nothing like it used to. And even though we can eat more now than when we first got out of surgery, we start to think and we start getting paranoid on overeating. Well, then we did actually go and have pizza one night. So
We bought a pizza,
Right.
and I mean, we didn't go for the little one. We want the big one.
way out. So I got a slice and a quarter done. That was it.
I was lucky to get a slice.
So yeah, one bite though is the difference between being comfortable and going to the bathroom to bring it back.
And you will learn.
And eventually you'll learn. It takes a while though. And some of us learn harder than others, I guess.
And I have an indicator. I get hiccups. As soon as I get the hiccups, I stop. I'm full. The moment I get the hiccups, not one more mouthful, and I'm fine. So I actually have a key indicator, which I'm lucky. But yeah, we've had our ups and downs. We've had our ins and outs, and
guys at work seeing the weight just dropping off. One had lap band surgery, and he'd lost nothing. And then I had the sleeve just dropping off to the point where even the supervisor said, geez, Mick, sooner or later, you're going to have to run around in circles in the shower to get wet. And still in our head every now and then we
still see ourselves.
We see ourselves as big, and we hear other people online saying, oh, my wife still says I walk like I'm fat. Well, because you've been doing it for so many years, we've all been doing it that way that we're kind of used to it. It's the little things you don't realise. Like I used to always wear my work boots with zip up side shoes. Just couldn't do the laces up properly. It's too hard.
Now he loves it.
And do whatever. Yeah.
So yeah, so we've had, it's for us, the surgery is great, but it's the non-surgical victories that mean the most.
I've tried them all. I've been to Jenny Craig. I've tried Weight Watchers. I've even had the Duromine. You name it, I've tried
We've
it.
tried every diet.
And it worked for a little bit. But then, come back to reality. And now you put it back on.
But now we're fine.
It'd all be perfect if we could all live in the biggest loser house where we do nothing but train all day and have good food shoved in our faces.
But we don't.
Most of them end up putting the weight back on because when they go back to the real world where you got to work, they put on, you can't train 8 hours a day.
And I worked on site. What's the biggest thing that you have on site? You have chefs there cooking for you. You have bain-maries.
All you can eat.
All you can eat buffet. You can take as many containers out that door as you want in the morning. The hardest thing for me was it took me 3 hours to eat lunch. I would start at about 11 and finish at about 1, and I would slowly pick. I had to go and talk to the chefs to get them to cook me meals because I couldn't eat what they were serving. And I'm sitting there and I'm watching guys throw down platefuls of food that for me to even think about now would make me sick. KFC, we can't even think about it, we can eat it now, but.
Before, all I used to do is drive past there and put on weight. That was it.
And now we don't even think about it. It's just not there. It's non-existent. And honestly, 12 months ago or 18 months ago when we're sitting there, we're going, yeah, right. We didn't believe us either.
One of the best months I read, when I'm going to hospital, I'm saying, Karen, what the hell are we paying for all this money for this private hospital? And Karen goes, the
God.
food's better. Well, that's going to help, isn't it?
So we've had some moments.
But as I said, we're each other's support the whole way through it.
And we wouldn't have been able to do it without each other. But the biggest thing is we wouldn't have been able to do it without family either. We've never hidden it and we never will hide it. We will shout it from the rooftops. We've had people on our website that have started fake profiles so their family don't find out about it.
Hell, I don't care. I'll tell whoever it is what I had done, where I had it done. But they don't like it. That's their problem.
And
not mine.
it definitely isn't the easy way out because it is a long road. It is mentally, it is physically, and it's just demanding on you the whole way.
How can taking yourself to hospital to have bits of your body removed be the easy way out? When you've still got to eat properly afterwards, you've still got to do the exercise and that.
It is a tool, but it's a tool that's going to work better than a fad diet.
Because it's a total change of life. And that's why you got to go in there thinking. Not think it's a quick cure, because it's not.
It's not. 18 months later, it's still messing with those occasionally.
It's a damn good tool, though.
How long ago was it you had your operation?
I had mine on the 13th of May.
When? This year?
Last year.
Last year.
Last year, 13th of May. Michael had his 2 months before me on the 12th of March.
Can I ask you how you guys deal with the loose skin?
Yeah, I haven't
Because
had
I
a
know
huge
the
amount.
older we get, the less elasticity it is and stuff like that, and I struggle with that.
I don't
Yeah.
go with it.
Yeah, absolutely.
I
Go
have
for
no
it.
issues showing everyone. I have this. Now, one of those photos that you can see, this was where I used to inject my insulin. Insulin makes you put on weight. Okay, it doesn't matter what they say. You're a diabetic. They say you've got to lose weight. When you're on insulin, it's a synthetic hormone. Doesn't matter where you put it, you're going to put on weight. I had an insulin baby. This is all I have left. I haven't had any surgery, nothing. We just rub cream into it. We just do what we have to do. We have a little bit here, but you know the worst thing I did, I lost my bum. That's the hardest thing for me. I've got complex.
Notice you got to move the car seat forward now?
Yeah,
And I kind
and
of
sitting.
exercise-wise, I kind of did the opposite to everybody else. Everyone else was jumping on treadmills and rowing machines and going ballistic. You know, I'm sitting there and thinking, well, I can eat less. I'm eating the right thing. Can't lose weight anyway. So I focus more on putting muscle back on. And trying to build my arms up so I didn't have quite as much loose skin. Yeah, definitely made a difference. So with arms and legs, yeah. So I've still got a little bit there, but nothing compared to considering I was 180 kilos.
Well, you've seen our photos, and neither of us had surgery for skin
Did you
removal or
have
anything
any
like that. It is what it is.
Knee pain, ankle pain, or hip pain before your surgery?
Me, I was lucky. Even at 180, I was still. I'd done a lot of martial arts and a lot of fighting in the ring and gym and stuff over the years. So even at that weight, I could actually kick my own head height still. So I was lucky. You know, at 180 kilos, I should have all sorts of medical problems.
Before our surgery, we looked at the stairs down the front and went, "Oh hell, is there a lift?"
Yeah, I must admit that thought crossed my mind.
It does.
Can I answer that question? I know I shouldn't be, but because I'm here for some reason, you guys are. Before I had lap band surgery, okay, I was 135 kilos. I had diabetes, I had asthma, and I had no joint space in either knee. Okay, my doctor turned around to me and said, "You've got two choices: double knee replacement or lap band surgery."
Yep.
I have not got any pain in my knees whatsoever, unless occasionally, if it's going to rain, you might get a little niggle. And something that my doctor cracks up laughing about is I've had scans on my knees in the last 12 months. And even though it says in the scan minimal joint space, we sit there and go, we have joint space. Okay? So yes, it does help. No, I'm not diabetic anymore either. And I was on tablets. My diabetes got up to about 19 at one stage. Yeah, which was extremely high. That's when I discovered I had diabetes. I don't have it at all now, and I haven't had it for quite a few years now. But I am having struggles with the band at the moment, and they did explain there's a couple of different reasons why. That's why I'm here at the moment, because of my issues. I did get down to 74 kilos, and they took fluid out of my band, and I ended up back up to 105 kilos because I didn't have the support network. And that's where my problem was. I didn't have this support network.
Thank you so much for sharing. No, thank you for sharing. These guys are absolutely amazing. We just absolutely love them. I love their honesty and their just their team together is just so special. Will you stay and have a chat to people and answer
Absolutely.
personal questions?
Absolutely.
You know, it's amazing in the mind. I've spoken to some of the chefs who say, and we have a lot of fly-in, fly-out patients, and a lot of the chefs will even say that they cook 3 times more volume of food than they actually should for the number of people, which is a really sad story to hear.
It is, and that's where a lot of the guys that I worked with, I worked out there for 4 years, and I've watched them put on weight and put on weight and put on weight, and I was one of them.
Yeah. And I think that's just the most ironic thing to hear you talk about a Duramind conference. If I had $1 for every person I spoke to every day who told me that their doctor had just put them on another course of Duramind, honestly, it makes my hair stand on end daily, because it's another Band-Aid fix. It's another drug. And a lot of people have a lot of problems on it. So yeah, just amazing.
We both tried Duramind.
It's funny you should say that, because I went to my doctor yesterday and I asked him for Duramind, because my youngest son had dropped 20 kilos on it. And he basically said to me, pretty much, look, if you're really desperate, he said, I'll give you the prescription. But he mentioned, what was it? Sudden chronic heart disease. And that just, I left there with no script.
Yeah. You get heart palpitations.
It's a pharmaceutical speed.
It's pharmaceutical speed.
Yeah, no, well, he doesn't like to give it out. And just from what he was telling me, I said to him, I said, well, you can just bill Medicare for having a nice little chat.
But you know what? When you're off your course of Duramind, habits, you haven't changed anything. You still go back to emotional eating. You still go back to...
You've lost weight, but you've also lost a lot of sleep.
One more day to Christmas.
One more day to Christmas.
Anyway, I would love to thank these awesome people. I have a special way of thanking them. They have had a really tough time, and I know they both love the gym. So what we're going to do for them is give them both a 3-month starter for a gym close to their home, so that they can get them back into the gym. A wonderful support to each other, but a great support to so many others online. And I think you're also part of our nutrition support page as well.
We're about to. We're having issues getting on that, but I think it's because we changed our email addresses, so we have to.
And Mick was just such a star at sending, constant feedback about where he was at, what he was doing, how much weight he was losing, especially someone who couldn't always come into the clinic. Fantastic to always be able to follow the journey.
I say I was driving him nuts.
No, it's wonderful, because you get to follow the journey and you get to share the story and see exactly all the milestones along the way. And I think that's just the cause.
There's one here photo before we go. There's one photo here of Michael and his motorcycle and this. The one thing he has always wanted to do was do a track day. Couldn't do it at 180 kilos. We couldn't find a skid suit that would fit him. We found this one that didn't quite fit him, and we were going to spend hundreds of dollars to get it. He can't even fit in there. We had to sell it.
By the time I put it back on, it was too late.
It was too late.
Way too big for it. It was way too big then.
So he never got to wear it. We spent hundreds of dollars and never got to wear it.
Is there a final question online?
Everybody wants to know how they can get in touch with these guys, just to follow them or have a look at their blog or support.
Yeah, so they're on a page called Gastric Sleeve and Bypass Support Australia, but they'll also be on our nutrition support page. So as patients at this clinic, we'd love you to have access through our nutrition support page, which is a WLSA private group.
Anybody is welcome to join our Facebook, post, or just inquiring.
So if they send a message through to Felicity,
I'll pass them on the details so they can connect and chat to these awesome people. Thank you so much for coming tonight.
Thank you.
Please stay and ask Karen and Mitch your questions. I'd just like to say thank you so much to our online viewers. Thank you for being with us tonight. We'll happily answer all of your questions. Please get in touch, and we hope to look after you very soon. All right. Thank you all so much. If you've got any final questions now, or you're welcome to chat to the team. We're happy to help you with finances, with appointments. If you're ready to take that first leap of faith and trust us with the next part of your journey, we would love to help you. Kelly and I are happy to help you with appointments, etc.
It's not a leap of
faith.
faith.
Answer any questions.
It's not a leap of faith. Trust me. Be the best decision you've ever made in your whole entire lives.
Yeah, no, absolutely. Couldn't agree more. Thank you so much. Thanks for coming along.
Thank you.